In the meantime, small business owners keeping a very close eye on Washington as Congress draws up plans for health care reform. They say they have good reason to be concerned. Small businesses employ half of all U.S. workers. They provide 45% of the total private payrolls in the U.S., and they say some of the proposed changes on the table today present a real threat to those of us working for a living. James Gelfand's the Senior Manager of Health Policy for the U.S. Chamber of Commerce. Good morning to you, Jeff. How you doing today?
Good morning, Bill. Thank you.
James, I have a question about whether or not what you do and you don't support about health care. What don't you like about what we've come to understand that is in the bill today, James?
Well, why start negative? Let's first of all say we do need something to get done. The question is, if the bills that are in circulation today are passed, will small businesses be better off or worse off? We would say worse off for a number of reasons. First of all, there's going to be a new requirement in these bills that says a small business must offer health insurance to its employees or it will pay a new civil fine. Second of all, small businesses will be threatened by a new government-run health insurance plan that could raise prices for everyone.
All right, so you would support what in that aspect of the bill then if it came before Congress?
Well, there are a lot of things that we do need to get done. We need to broadly implement health information technology. We need to make a new focus on wellness and prevention and disease management. We need to boost primary care. And there's a lot of things that Congress can all agree on. The problem is we're getting stuck and distracted on this 5% of ideological problems in these legislation.
Well, there's others who would contend businesses with fewer than 100 employees. I know during the introduction we talked about businesses with fewer than 500 employees, but 100 employees or less. They would save about $855 billion over 10 years. Now, this is the other side of this whole argument. Do you buy the number?
That would be a great number if it had anything to do with reality. I think, unfortunately, right now, businesses spend about $500 billion per year on health insurance for employees. They spend that money voluntarily. Now, if you're telling me that you think a new requirement forcing businesses to purchase health insurance will save the money somehow, I'm going to have to call fuzzy math.
Well, fuzzy math. Well, around here we call it the hooey card, but, you know, I mean, that's my phrase, not yours. Ultimately, businesses want to save money, and they want to drive down health care costs. How are you able to do that, given the friction in Washington today that would force employers not necessarily to spend more money, but to keep their businesses strong through this, Jeff?
Well, what we have to do is find a way to reform the healthcare system that doesn't cost jobs. Now, under a model developed by President Obama's own head of the Council of Economic Advisors, some of the legislation right now being considered could cost the country between 4 and 5 million jobs. We can't afford that right now. What we need to do is focus on these areas of consensus. We talked about health IT. We talked about prevention and wellness. Let's talk about things that everyone can agree upon that won't cost $1 trillion, that won't create new mandates for employers and employees, that'll help the economy and that'll lower costs for everybody.
Is your big position, and you don't want to have the employers to have to pay the tax on the health care?
Well, let's be clear. Employers don't pay taxes. Employees pay taxes. So what happens is when you create a new tax on employers, and this study has been done by numerous political scientists and economists and whatnot, when you create a new tax on employers, employees pay those taxes.
And you think that's the result of a new health care reform?
Well, that'll happen if we pass the Kennedy bill or the Rangel bill that are out there right now. But it's not too late to fix this thing, to go back to the drawing board, and to get something we can all support.
Well, we'll see what comes out in the end, because frankly, we don't know. But James Gelfand, thank you for your time this morning. I understand your position, and we will see which way it goes. 18 minutes past the hour now. Thank you, sir. Here's Megan.
Well, the president promised to, quote, call out any wasteful